Hello, my name is Martin. I am patient on the Grace Health Clinic. I want to say that I went to the clinic. I went to the hospital because I felt really bad. At that point, it was a night on CU, Aurora. They treat me like I got a cold. I got an IV. Next day, I went to the test. I got the test. The next day, they gave me 3 county, called me, says you are positive on COVID. Follow up with your family doctor. That's when I immediately called the Grace Health Clinic because my doctor, he fixed everything I had. So I said, came here. I got so much faith on him. I have to say it. I have to say it. Otherwise, I don't know. So I came here at 3 o'clock. The same day I got the notice from 3 County, and I explained that I got positive. It took me with precautions into the room. They administered this injection, one of my Botox, and there's these 4 pills. They said, go back home. You cannot be out you'll be in quarantine for a couple of weeks. I said, well, yeah, this is bad. The same day my wife was treated. He got 4 pills. The same day, because my wife called me, says, make an appointment. At 3:30 she came. She got no injection, we got the 4 pills. I got the injection plus 4 pills, and we got both quarantine at home. Myself, I can say that I started getting some kind of changes in my body 2.5 days after they administered this injection. They explained me they take this pill once every day. The first day 2, and the rest 1 a day. My wife, she started feeling good in the second day. She was totally recovered. I guess she came to the right time. Myself, I continued with my current quarantine. After 4.5 days, I start feeling a recovery of me. I was so happy because it was not really a good experience at home. Whatever the doctor administered me, medicine, or even the pills, I start feeling that. By Monday, Tuesday, the second week of quarantine, that's where I didn't took anything. No medicine or nothing at all. I just wait for the Friday to come here and do the test if I got negative or positive. I came on Friday. And I have a call the next day, a call or email, I don't recall. That was Monday, I'm sorry. Monday, saying that I'm totally negative. So that's the story with Grace Health Clinic. I'm so grateful. I think a lot of people, they need to know what the doctor worked on, and his partner. I think it was a great experience for me, and so grateful with this clinic since 2017. I'm using them, and a great experience.
If coronavirus is packed with the M protein, then we would assume that coronavirus can actually give all the signs of shock. So how does the shock work? There are different stages in the shock. So initially, the patient is going to be able to compensate. How does the patient compensate? With increasing the heart rate. But at some point, as the heart rate goes up, the blood pressure continues to go down, and the germ continues to attack and cause the fever. At some point, the patient gets to a stage where the symptoms become irreversible. And that's when it's usually too late. So it's very, very important to recognize the initial symptoms, which as hypotension, tachycardia, fever, and act very quickly.
Hola, mi nombre es Martín. Soy paciente de la clínica Grace Health Clinic aquí en Aurora. Fui diagnosticado de COVID en la Universidad de Colorado. A ese punto tomé la prueba para el COVID y me mencionaron, me trataron diferente, me trataron como si fuera una gripe, un resfrío. Me pusieron intravenosa, pero me mencionaron que tenía que seguir a mi médico de cabecera, que me hiciera el test al siguiente día, lo hice, a las 24 horas recibieron la prueba que tenía el COVID, que llamara al hospital. A ese punto llamé al hospital, a la clínica, al Grace Health Clinic, el doctor Frank, me dieron una cita. Ese mismo día que recibí la noticia de Tree County, del condado, de que estaba infectado con COVID-19, que estaba positivo, inmediatamente me metieron al cuarto, me administraron una inyección en la parte de atrás, me dieron 4 pastillas. En ese punto regresé a casa. Mi esposa también fue tratada, pero creo que vino al tiempo correcto. En casa, pues seguí sintiéndome mal, pero sentí los efectos de la medicina que me administró el doctor en 2 días. Pasaron 4 días y esta medicina que administró, tengo que agradecer a la clínica Grace Health Clinic, que en cierta manera me salvaron la vida porque no es un virus muy amigable. Mi esposa se alivió en 2 días, cosa que le agradezco también porque no hubiera soportado si mi esposa hubiera estado enferma. A ese punto pasaron 2 semanas. La última semana que me ordenaron estar en reposo y estar confinado a mi cuarto fue cuando no tomé ningún medicamento. Llamé a la oficina para que hacían la prueba. Fue un viernes, al final de esa semana, me indicaron que estoy negativo, estoy limpio, tengo las pruebas. Eso pasó hace ya un mes y algo, y estoy libre de ello.
So we thought that if we can give a medication that will disrupt the cell membrane, and then another medication that will prevent the virus to come out of the cell and attack another cell, then we would inactivate the whole process. And that's what we did. So if we look back at coronavirus here, the membrane, we would assume that cephalosporin will attack the M protein and disrupt the whole membrane. And then Tamiflu would actually prevent, so if this is coronavirus, comes in here, uses all the cells products to get built and go back out to attack other cells, then Tamiflu would prevent this to happen. So there wouldn't be any budding or any exit from the cell. And that's exactly what we give to our patients.